So we're going to move on, though, in the meantime, to our next speaker, that is Ms. Chelsey Burden. Hi, Chelsey. Chelsey obtained her bachelor's degree in genetics from Texas A&M University, her master's degree in genetic counseling from the University of North Carolina at Greensboro, and she's been working as a certified genetic counselor at Baylor University Medical Center's Hereditary Cancer Risk Program for over 4 years now. She's actively involved in the National Society of Genetic Counselors and the Texas Society of Genetic Counselors. She's really passionate about helping people understand all of the various benefits, limitations, and implementations of genetic testing, while of course encouraging everyone to be proactive about their healthcare. So thank you, Chelsey, for having, and please introduce yourself and share what you have to say.
Thank you, Sam. So I'm so excited to be with y'all today. I am going to go ahead and share my screen. Perfect. Okay, so yes, I'm Chelsey. I am a cancer genetic counselor at Baylor Scott & White here in Dallas. And I just wanted to take the next 20 minutes or so just to walk y'all through genetics, specifically behind melanoma, and how really melanoma can impact an entire family. And so I wanted to break down genetic testing and what exactly that is and what it might mean for you and for your family, and also give you some real life case examples of people that I've seen and ordered genetic testing for, and specifically how that can help people just being proactive about their own healthcare, and also encourage their family members to be proactive as well. And so I just want to start off a little bit by breaking down genetic counseling and what exactly it is. I know it's a field that a lot of people haven't heard of, and a lot of people are now very familiar with genetic testing in terms of ancestry. And so we see advertisements all the time on TV, or even when you're walking down the grocery store and you see by the checkout line a kit that's advertising genetic testing for your family. So people have heard of genetic testing in that realm, but they may not have heard about genetic testing and genetic counseling as it relates to cancer. And so what I would love to do is just break it down for you and tell you what exactly it looks like from a cancer perspective. And so as a cancer genetic counselor, what I do is I meet with people who either have cancer themselves, whether that be a diagnosis of melanoma or another type of cancer, or someone that has not had cancer themselves, but maybe a couple people in their family have had cancer. And so we take a really detailed medical history, family history, and I'll show you examples of that in just a little bit. And we really just try to determine what the chances are that there could be an underlying genetic cause within a family that's causing some of the cancer in that family. And then we order genetic testing and we interpret the results for that person, again, to encourage them to be as proactive as possible about their healthcare, and also sharing that information with their family members as well, because we know that we share our genes and our DNA with people that we're related to. And so genetic testing doesn't just impact that person, it impacts their family as well. And so genetic counselors help navigate all of that. So we just heard a lot of the risk factors for melanoma. So here's just a repeat. I'm not going to spend too much time on that. But again, the biggest risk factors are, of course, sun, having fair skin, red hair, lots of freckles, and as well, like we just heard, lots of moles. So we know that those are all risk factors for melanoma. And so 90% of the time, melanoma is going to fall into a sporadic category, or in other words, it's not genetic, and it's caused by a variety of environmental factors like we just heard. 10% of melanoma is hereditary, though, where there is one single underlying genetic cause for the melanoma for that person or within the family. So that's the piece of the pie that our testing will tell us about, and we can try to determine which of these two categories someone might fall into. So just to zoom in on that a little bit more, when we're talking about the breakdown in melanoma, again, the two main categories there are sporadic and hereditary. So when we're talking about genes in general, we know that genes are almost like an instruction manual for our bodies, in the sense that they tell us how to grow and develop properly. And we have genes for everything. So y'all know we have genes for our eye color, our hair color, you name it. And then there are also certain genes called cancer genes, and everyone actually has those too. And the cancer genes are actually good for us to have because they're supposed to be protecting our bodies from getting cancer, or fighting cancer off, in other words. And we have 2 copies of every gene. We get 1 copy from our moms, 1 copy from our dads. So half of our genetics comes from each parent in that sense. So that's just to set up this slide here. When we're talking about melanoma, again, the vast majority of people when they're diagnosed with melanoma are gonna fall into this sporadic category. So hopefully you can see my mouse here. So within the sporadic category, people are born with their cancer genes normal and working properly. And these are supposed to be genes here. So those columns there, if you can't see my mouse, the blue columns, so one copy comes from mom, one copy comes from dad. So we're born with those cancer genes that are doing their job and they're protecting our bodies from getting cancer. Now, maybe 30 or 40 years could go by and we can randomly get a change or what's called a mutation in one of those cancer genes. And so that's notated by the X here. So at that point, even though we have mutation in one of the genes, the other gene is still acting as a working backup copy, and it's still doing its job, and it's still protecting our bodies from getting cancer. But maybe another 20 or 30 years could go by, and by chance, someone might develop a mutation in that other copy of the gene. So in this case, both of the genes have a mutation on it. There is no longer a normal working backup copy, and this is eventually what leads to someone being diagnosed with melanoma or another type of cancer. So usually these sporadic cancers happen just over time, a little bit later in life, when people are in their 50s, 60s, 70s, and 80s. Within the hereditary category, on the other hand, and again, up to 10% of melanomas will fall there, people are born with a gene mutation. So you can see it's like they're starting at this second step here. But they're also born with that other gene that acts as a working backup copy. And that could be a gene that always works throughout our lifetimes, and we could never get any type of cancer, and it could always fight it off for us. But for some people, as time goes on, and maybe it's 30 or 40 years down the line, they might eventually get that second gene mutation. So same thing we just talked about, if somebody has both copies of their gene with mutation, they don't have a working backup copy, neither gene is doing its job, and that's what ultimately leads to a diagnosis. So usually these hereditary versions of melanoma will happen a little bit earlier in life, like in the 30s and the 40s. And that kind of makes sense if you think it's like someone starting at that second step there. And sometimes there might be a higher risk for more than one melanoma or type of cancer to develop with that person or maybe within their family as a whole. And that's definitely something I'll touch on in just a little bit as well. Before we get to that though, sometimes we are on the lookout for specific things that make us think that someone might fall into that hereditary category or that there might be an underlying genetic cause for melanoma. And so usually we're looking for a family history of several things. So it could be anyone in the family who's had 3 or more melanomas themselves, so one person in the family having at least 3 melanomas, or if we're starting to see a combination of different melanomas and types of cancers in a family. So if we see melanoma of the eye, we know that's more rare. So sometimes that can be a sign that there might be an underlying genetic link in this family. Or if we start to see a correlation of melanoma and other cancers, like for example, pancreatic cancer, sometimes there can be an association there from a genetics perspective. Or astrocytomas are basically tumors of the brain or sometimes even the spinal cord that might be linked to melanoma. So if we see any of these things within that person or their family, it automatically warrants a referral for genetics. And again, we know that genetic testing doesn't just impact that person, it impacts their family as well because we share the same DNA as our family. We actually have half the same DNA as our brothers and sisters. We pass on half of the DNA to our own kids as well. And so this just shows how exactly these gene mutations might be passed down from generation to generation. So if somebody falls into this hereditary category, again, they're born with one of their genes having a mutation on it and the other one not. So when that person goes on to have kids themselves, there's 2 options about which copy of the gene they could pass on, the copy that has the mutation or the copy that does not. So it is a 50% chance, or like a flip of a coin with each pregnancy. So testing one person in the family will let us know if we ever need to test anyone else in the family, like kids, brothers and sisters, or more extended family members as well. So a lot of people say, you know what, my genes are what they are. Why would I want to do this genetic testing? Why would I want to know this information? And you know, that's a really good question. One reason is it could help us with treatment options. So if someone is going through melanoma treatment right now, it could let us know if there's something else we might need to be doing for that person to treat their current diagnosis better. It could also let us know if they might get an increased risk for another melanoma or another type of cancer in the future, in which case, hey, let's do everything we can to prevent that from ever happening for that person. And it's also, like we said several times now, helpful for the family, and we can hopefully prevent people in the family from ever developing cancer as well, or catching it as early as possible. Some people may not want to know this information though, for these reasons. Usually the most common thing that we hear if somebody declines testing is some people are just a little bit worried about it, and they just think that knowing this information might increase anxiety. They don't want to know if they're at an increased risk for another type of cancer. And you know what? I think that that's a valid concern. And at the end of the day, our genes, you are the only one who gets to decide if you want to know this information, because once you learn this information, it's kind of hard to forget it. And so we really want to make sure that people are making informed decisions when it comes to genetic testing, that they are prepared to know this information and that they feel like they can take action on it too. Something else that commonly comes up is some people are afraid about discrimination based off of genetic test results. And I'm going to touch on this a lot in just a little bit, but there is a federal law that protects people from being discriminated against based off genetic test results. So stay tuned there. Sometimes people are just worried as well that this might impact things negatively within their family. And some people sometimes might feel burdened about sharing this information with their family members. And so that might be one reason why people may choose not to get genetic testing done. And sometimes with the current diagnosis, genetic testing may not change things for that person in terms of their own medical management. So these are reasons why people may choose not to get testing, but there are also, on the flip side, a lot of benefiting factors as well that, again, I'll touch on in just a second. So genetic testing itself can usually be done on either a blood sample or a saliva sample. It usually takes about 3 weeks to get the results back. Whenever we get results back, there are 3 different outcomes that we could get. The first is what's called a positive result. So that means we found a mutation in one of the genes. So we know for that family, they fall into the hereditary category. And at that point, the genetic counselor will break it down for you and tell you exactly what you need to know. So we'll say, okay, here's the gene, here's the cancers associated with that gene in particular, and most importantly, here's what we're going to do about it, and here's how we take the best care of the whole family now that we have this information. We can do genetic testing though and not find anything and get a negative result back. So big picture, what that means is the melanoma most likely will fall into that sporadic category that we talked about in the very beginning, because 90% of all melanomas, and really just cancer in general, will fall into that sporadic category, and there's not an underlying genetic cause for that cancer diagnosis. There is also a third category, and it's a little bit of a gray area. It's basically called an uncertain result. And so what that means is we found a change in one of the genes, but unfortunately we just haven't seen that exact same change enough times and enough people yet to know what it means, which is why it's called uncertain. So I will say 95% of the time, that is absolutely nothing to worry about. And it's something that just makes maybe you and different from me, and it's not harmful for people to have that uncertain result. And so we usually treat these uncertain results like they're negative or a normal result. Not always, though. I will definitely just say, in general, genetic testing is often not black and white, and sometimes it can be really hard to interpret these results. And that's why I would encourage you, if any of y'all are interested in pursuing genetic testing, or if you already have had genetic testing and you have questions about your results, that I would reach out to your friendly neighborhood genetic counselor, so that way they can break this information down for you and make sure you've got a good understanding of what the results mean for you and for your family. So we know now that there are a lot of different genes that might be related to hereditary versions of melanoma. And here are just some of the genes listed here. For the sake of time, and also not to bore you to death, we're not going to go through all of those genes in particular. But in general, here's just an overview. On the far left, it lists out the gene name in particular. In the middle there, it tells you if there's some sort of fancy syndrome name that goes along with it. It's listed out. And on the right, it's going to tell you what the risk of getting melanoma is if somebody is born with mutation in one of those genes. So while each of these genes are associated with melanoma, they could also be associated with other cancer types as well. So just to use it as an example, that second one down the list there is the BRCA2 gene. Some of y'all may have heard about that gene, especially as it relates to breast and ovarian cancer, because that is usually a gene that is more commonly heard of within people who have breast or ovarian cancer, because it does cause an increased risk for those types of cancers. But there also is an association with melanoma and a couple of other cancer types as well. So that just goes to show you that each gene, again, could have more than one cancer associated with it. And the benefit of knowing this information would be to try to prevent not only melanoma, but ideally one of those other types of cancers from happening too. Okay, so I wanted to give you all some real life examples of people that I have seen in order genetic testing on. And so again, as a part of genetic counseling, if you were to meet with a genetic counselor, they would ask you a whole bunch of questions about your family and draw out a family tree like what you see here. And some of you may have seen a picture that looks like this before. If not, the way you look at this, and I hope it's coming across on your screens okay, the way you look at this, squares are males and circles are females. And if anyone is shaded in, that person has a diagnosis of some type of cancer. So the person that I saw in my office was, with the little arrow pointed at him here, this man is 71 years old. He was diagnosed with melanoma at the age of 32, bladder cancer at the age of 59. He had a squamous cell spot at 61. And he also had a whole bunch of moles. So he guessed that he is probably over 200 moles in his body. So this is the person I saw in my office. When we took his family history, we saw that he actually has a really strong family history of melanoma and a couple other cancers as well. So his sister here was diagnosed with melanoma at age 64, and then unfortunately passed away a few years later from pancreatic cancer. Their dad had several melanoma spots in his 30s and his 70s. And unfortunately, he passed away from his melanoma that had metastasized. And then there's also a great aunt here who had melanoma that passed away at the age of 32, so really, really young. And then there's a cousin on dad's side of the family over here who had melanoma and also pancreatic cancer. So this is a family history that definitely jumps out at us because multiple people in the family have had melanoma at young ages, and we're seeing it passed down through the generations, or at least it looks like it's being passed down. So definitely was appropriate to order genetic testing on this family. And this is what we found. So we found a positive result or a mutation in this one gene in particular. The gene name is called CDKN2A, which is a little bit of a mouthful. You don't need to remember that gene by any means. But essentially, if somebody is born with a mutation in that gene, a family is at a higher risk for melanoma and also for pancreatic cancer. So this actually explains for this man and his family why so many people have had those particular types of cancers. But now what? Now that we know this information, what are we going to do about it for this family? Let me tell you. So here is a breakdown of what's recommended for people if they have a mutation in this gene in particular. First thing we want to do is make sure we are on top of our skin cancer screening from a really young age. So we actually would start in childhood, having kiddos get plugged in with a dermatologist and having a full body skin exam at least twice a year from the age of 10. And also just educating kids and parents and adults in general about, like we just heard, the signs of melanoma, and also just educating people on sun protection, how important that is for them and for their family. And then also because there is that increased risk for pancreatic cancer, that's also something that we want to be on top of. And so we would actually do imaging of the pancreas and a blood test once a year to screen people who might be at a higher risk for that type of cancer, ideally to catch it as early as possible. So going back to this family, again, I saw this man here who is 71, and we found this positive result, this gene mutation for him. So then that told us that we needed to test other people in his family because there's a very high chance that other people have this exact same gene mutation. Specifically for his sons, again, we pass on half of our DNA to our kids. So we then tested his sons here. So his youngest son here is 39. He was also found to have that same gene mutation. He has not had cancer. So at this point, we wanted to get him plugged in with a good dermatologist and a good doctor who can perform the pancreatic screening with him to encourage him to be as proactive as possible and hopefully prevent those cancers from happening. We tested his older son as well, his 46-year-old son, and he was not found to have the gene mutation. So we now know that this son is not at a higher risk for melanoma or for pancreatic cancer. That does not mean he could never get those cancers. It just means we do not need to be as aggressive with our screening as we would if he had that gene mutation. We were actually able to track this through the family. And again, Dad's side has had a pretty strong history of melanoma and pancreatic cancer. And we found out that this cousin over here, this first cousin, she was also found to have that same gene mutation. And so now there are a lot of people that we can do extra screening for to take the best care of this family. So I just want to give you one more example here of another family that was a little bit more unusual in the sense that this woman came to see us. She's right here with the arrow pointed at her. She's 42 years old and she was diagnosed with melanoma of the eye a year prior, so at 41, so pretty young. Her brother here was diagnosed with kidney cancer at age 42. Their father had several melanomas of his skin and also a melanoma of his eye as well. So because of the rare eye melanoma, multiple generations, and young ages of diagnosis, this family definitely warrants genetic testing. So that's what we did. And we found a positive result or a mutation in another gene called BAP1. This gene is actually associated with melanoma of the skin and the eye. And we also think that there could be a correlation with kidney cancer as well. So again, this explains a lot of the diagnoses within this family. But again, okay, we know about this, but what are we going to do about it? And how are we going to be proactive for this family? So again, we want to make sure for kids, we want to start their education from a very young age about melanoma characteristics and how important it is to practice good sun protection and get them plugged in with good dermatologists at a young age. And also because there's an increased risk for this gene in particular to have melanoma of the eye, we want to make sure that we get people plugged in at a young age, ideally, with an ophthalmologist to do regular screenings of their eyes just to make sure we're on top of things from that perspective as well. And then because we think that there might also be an increased risk for kidney tumors, we want to make sure that we're taking a look at the kidneys as well. So we do some imaging of the abdomen, maybe every 1 or 2 years, and that might just depend on if somebody has a family history of that or how proactive they want to be with their screening in that sense. So again, this woman was found to have this gene mutation. It helped us know for her what we should be doing, but also helped let us know that we need to test other people in her family as well, again, to be proactive. So switching gears a little bit, I mentioned in the very beginning how some people are scared, for lack of a better word, about doing genetic testing because they are afraid of discrimination based off of their genetic test results. So I wanted to tell you all about this federal law that was passed in 2008. It's called GINA, which stands for the Genetic Information Non-Discrimination Act, which is a mouthful, so it's GINA for short. And that law says that health insurance and jobs cannot discriminate against someone based off of having genetic test results, which means you can never lose health insurance, be charged a higher premium every month, lose a job, be denied a job opportunity from having genetic testing. So that is all protected, which is great. While it is a good law, it's not perfect. So there are some things that are not explicitly covered by this law. Specifically, that would be disability. So short-term, long-term disability, long-term care policies, life insurance policies. And then for people who have government insurance, so active duty military, so people who have TRICARE, or for people who might get healthcare through the VA, or other federal insurances like federal employee benefits, or people who get healthcare through the Indian Health Service Act. Unfortunately, those policies are not explicitly covered by this federal law. that being said, usually if these policies, like life insurance, are in place before we do genetic testing, it's not a problem. If anything, on the back end, it might just be a little bit more challenging to take out one of those policies after we've gotten a positive genetic test result back. Not always, it just depends on the specific company. But what I always want to encourage people is that they look into their policy, so specifically life insurance and disability, and just be aware of what they are before they go through with genetic testing. And if we really want to be on the safe side, go ahead and have those policies established before genetic testing is performed. So just so y'all know, that's out there, and that really is a good law, because at the end of the day, health insurance, job status cannot be impacted. And finally, I just want to say that genetics is only part of the puzzle, and we've come a long way in the genetics realm, and we've learned a lot about melanoma over the years, but still we know that only 10% of melanomas are actually hereditary. And like we said, the vast majority of the time it's caused by all of these other environmental factors as well. But genetic testing, even though only 10% of people we might find a mutation for, it's still helpful for us to know that information, to know which category your family might fall into, because it could tell us if there's something else we can be doing to take the best care of you and your family moving forward. And so that's why I think it's just so important for you. If you've got questions about your history, your family history, if you're wondering whether or not there could be a genetic link in your family, talk to your doctor and ask for a referral to a certified genetic counselor who can really just walk you through your family in particular, talk to you about what the chances are for your family, order genetic testing, and of course answer any questions that you have. And at the end of the day, you know, our genes are what they are, and we can't control whether or not we have a gene mutation. We can't control the genes we got from our parents, and most of the time we can't control the genes we pass on to our kids. So although we can't change what our genes are, if we know if there's a mutation, we can do something about it, and we can be proactive. And so knowledge really can be power in this situation. And with that, I am happy to take questions, although I think Sam said that we're going to hold them all until the very end, and I will take them at that point.